Hey, what's up, you guys? Did I get your adrenaline going or your noradrenaline going? Thank you, thank you, thank you. Anyways, today we're going to be talking about a critical medication, and it's used in a lot of emergency situations. It is called norepinephrine. People also have called it noradrenaline, but also has the name Levophed. In here, we're going to go ahead and work and break down how it works, the drug class, common side effects, key nursing interventions, plus we'll cover essential teaching points for our patients to ensure they're well informed about their treatment. Let's get this started. So norepinephrine is in the class vasopressor. It's also classified as a sympathomimetic because it is mimicking norepinephrine in the body, triggering our flight or fright response. This is typically used in critically ill patients in situations such as shock, where maintaining blood pressure is crucial for survival. So how does it do it? So it works on the blood vessels, and when they're dilated, blood is flowing smoothly but not fast. But when they're constricted, blood is pounding out, shooting out fast, kind of like a hose, but think about it as Pocahontas in that one scene with the two rivers. Let's talk about side effects. Ooh, ouchie. So let's talk about side effects. Tachycardia. It's going to make our heart rate go up because it is a fight or flight response. Hypertension. It is a vasopressor, so we want the blood pressure to go up. Arrhythmias can occur, and then also anxiety can happen. This is because it's hitting our cardiovascular system. Okay, so that's like all you need to know, right? That norepinephrine is a vasopressor and that there are side effects such as like bradycardia, arrhythmias, and hypertension. But what about pre-administration, post-administration, patient teaching? Yeah, you're right. Yeah, let's get into that. Yep, gotta stay safe. So let's talk about pre-administration assessments such as baseline. We're gonna get blood pressure, heart rate, and their SpO2. We're also going to put a cardiac monitor on them. Why? Because a big side effect is arrhythmias. And then lastly, we're going to assess their volume status because if they're hypovolemic, it's not going to work as well. So we need to make sure we add in fluids for them. For post-administration, we're going to use our baseline, which is the blood pressure, and the heart rate. We're going to maintain a target blood pressure. We're still monitoring for arrhythmias because, hello, it's a side effect. And lastly, we're going to be checking peripheral circulation because of the constriction of the blood vessels. So when getting the patient off the medication, we're going to wean them off the med. Their heart rate's good, their blood pressure's good, they could be titrated lower. And if that's the case, we're going to monitor them because we don't want to have a withdrawal. Withdrawal will cause hypotension. Also, when they're completely off, we're going to continue to monitor them. Let's educate that patient. The purpose of norepinephrine, why are they on it? They need to know. It's because their blood pressure was dangerously low, so we had to increase it. Let's educate them the importance of blood pressure. Blood carries oxygen to all these vital organs. If the blood pressure is low, blood is not going to go to these organs down here that I'm drawing for you. We're also going to inform that patient that they're going to be monitored. We're monitoring their blood pressure, we're monitoring their heart rate, and we're also monitoring their heart itself for the arrhythmias because it's a side effect. Also, effects they might feel. They might feel a fast heart rate, they might feel coolness in the hands and feet, but they should know to notify us if they're having chest pain, if they're having a severe headache, and also if they're feeling tingling or numbness in the fingers or toes. These are big indicators that the dosage needs to be adjusted. And there we have it. Just in 5 minutes, we were able to learn about a life-saving drug called norepinephrine, how we use it, things that we should be looking out for. It is important to know that this is a critical care medication, which means monitor, monitor, monitor. We're monitoring that patient to ensure safety. But that's it.